Welcome to my channel Health for You. Treatments for type 1 and type 2 diabetes. Treatment for type 1 diabetes involves insulin injections or the use of an insulin pump, frequent blood sugar checks, and carbohydrate counting. Treatment of type 2 diabetes primarily involves monitoring of your blood sugar along with diabetes medications, insulin, or both. Monitoring your blood sugar. Depending on your treatment plan, you may check and record your blood sugar as often as several times as a week to as many as 4 to 8 times a day. Careful monitoring is the only way to make sure that your blood sugar level remains within your target range. People who receive insulin therapy also may choose to monitor their blood sugar levels with a continuous glucose monitor. Although this technology does not yet replace the glucose meter, it can provide important information about trends in blood sugar levels. Even with careful management, blood sugar levels can sometimes change unpredictably. With help from your diabetes treatment team, you will learn how your blood sugar level changes in response to food, physical activity, medications, illness, alcohol, stress for women, fluctuations in hormone levels. In addition to daily blood sugar monitoring, your doctor will likely recommend regular A1C testing to measure your average blood sugar level for the past 2 to 3 months. Compared with repeated daily blood sugar tests, A1C testing better indicates how well your diabetes treatment plan is working overall. An elevated A1C level may signal the need for a change in your insulin regimen or meal plan. Your target A1C goal may vary depending on your age and various other factors. However, for most people with diabetes, the American Diabetes Association recommends an A1C of below 7%. Ask your doctor what your A1C target is. Insulin. People with type 1 diabetes need insulin therapy to survive. Many people with type 2 diabetes or gestational diabetes also need insulin therapy. Many types of insulin are available, including rapid-acting insulin, long-acting insulin, and intermediate options. Depending on your needs, your doctor may prescribe a mixture of insulin types to use throughout the day and night. Insulin can't be taken orally to lower blood sugar because stomach enzymes interfere with insulin's action. Often, insulin is injected usually using a fine needle and syringe or an insulin pen, a device that looks like a large ink pen. An emerging treatment approach not yet available is closed loop insulin delivery, also known as the artificial pancreas. It links a continuous glucose monitor to an insulin pump. The device automatically delivers the correct amount of insulin when the monitor indicates the need for it. There are a number of different versions of the artificial pancreas, and clinical trials have had encouraging results. More research needs to be done before a fully functional artificial pancreas can receive regulatory approval. However, the first step toward an artificial pancreas was approved in 2013. Combining a continuous glucose monitor with an insulin pump, the system stops insulin delivery when blood sugar levels drop to low. Studies on the device found that it could prevent low blood sugar levels overnight without significantly increasing morning blood sugar levels. Oral or other medications. Sometimes other oral or injected medications are prescribed as well. Some diabetes medications stimulate your pancreas to produce and release more insulin. Others inhibit the production and release of glucose from your liver, which means you need less insulin to transport sugar into cells. Still others block the action of stomach or intestinal enzymes that break down carbohydrates or make your tissues more sensitive to insulin. Metformin, glucophage, glometaza, others is generally the first medication prescribed for type 2 diabetes. Transplantation. In some people who have type 1 diabetes, a pancreas transplant may be an option. Islet transplants are being studied as well. With a successful pancreas transplant, you would no longer need insulin therapy, but transplants are not always successful and these procedures pose serious risk. You need a lifetime of immune suppressing drugs to prevent organ rejection. These drugs can have serious side effects, including a high risk of infection, organ injury, and cancer. Because the side effects can be more dangerous than the diabetes transplant, are usually reserved for people whose diabetes cannot be controlled or those who also need a kidney transplant. Bariatric surgery. Although it is not specifically considered a treatment for type 2 diabetes, people with type 2 diabetes who also have a body mass index higher than 35 may benefit from this type of surgery. People who have undergone gastric bypass have seen significant improvements in their blood sugar levels. However, this procedure's long-term risk and benefits for type 2 diabetes are not yet known.